हेलो एवरीवन। आज मैं आपको नर्सिंग पोस्टनेटल केयर के बारे में बताऊंगा। एनसीपी ऑन पोस्टनेटल केयर। इसमें सबसे फर्स्ट आइडेंटिफिकेशन डाटा, नेम, एज, आईपी नंबर, एलएमपी, लास्ट मंथ पीरियड, डेट ऑफ डिस्चार्ज, डेट ऑफ एडमिशन, obstacle score, date of delivery, mode of delivery, occupation, religion, address, introduction to the patient. My patient name is, she is 24 year old. She is admitted in ward 24.4 2021 with their chief complaint of abdominal pain. Socioeconomic data, patient socioeconomic data is good. Then next come family tree. Family analytic history. Patient family has no significant past present history of HIV. Personal history, menstruation history, duration of menstruation 3 days plus menstruation started from 14 years ago. Past medical history, there is no past medical history. Past surgical history, there is no past surgical history. Investigation, name of test, normal value, obtained value, remark, HB, blood count, hemato. Then it come to physical examination, journal, appearance, good, height, weight, temperature, pulse, respiration, BP, head to foot assessment, head, face, patient has dark face, skin pale yellow, eyes symmetrical, ears symmetrical, nose normal, no foul smell from mouth, nose good, chest normal, breast normal. Then next come to abdominal infection, shape symmetrical, size bowl, no abdominal 93 centimeter, gestation week 33 days, fundal 23 centimeter, palpation, back present in body, extremity normal, routine normal. Next come to nursing diagnose, acute pain related to surgical procedure as evidenced by patient verbalization. Second is risk of infection related to abdominal cavity. Third is anxiety related to symmetrical procedure. Fourth, knowledge deficient regarding disease, sleep pattern, disturbed sleep pattern related to hospitalization environment. So first in nursing diagnosis assessment subject, nursing diagnose, goal, intervention, implementation, evaluation. First assessment, subjective data. Patient said that I have muscle pain in my abdomen during season. So objective data is abdomen pain, swelling and discomfort is observed. Acute pain related to surgical procedure as evidenced by patient verbalization. Goal is to reduce the patient pain. Assess the patient pain level by using pain scale. Provide comfortable position to patient. Provide healing pad to live. Provide psychological support to patient. Admit analgesic to the patient. Pain is assessed. Implementation. Comfort position provided to patient. Healing pads are provided to patient. Psychological support provided to patient. Analgesic given to the patient. Evaluation. Now patient condition is good. Second, NCP patient say I have no idea of these disease. Objective fear and anxiety. Diagnose anxiety related to the surgical procedure. Go to receive from anxiety. Assess the level of anxiety. Provide comfort environment to patient. Sure the any question. Explain procedure to patient. Give health education to patient. Implementation level of anxiety assessed. Comfortable environment to patient. Question are asked. Procedure explained in patient. Education given to the patient. Now the patient evaluation is, now the patient feel good as evidenced by no fear of anxiety. Next nursing diagnose. Subjective the patient say that here disturb in sleep pattern due to pain, anxiety, and hospital environment. Nursing diagnosis describe disturbed sleep pattern due to hospitalization, pain, incision. Goal to improve sleeping pattern of the patient. Assess intervention. Assess the normal sleeping pattern of the patient. Provide comfortable position to patient. Provide analgesic to the patient. Evaluation. Sleep pattern is as comfortable position given to patient, analgesic given to patient. Evaluation. Now the patient condition is normal. Next come to health education. Personal hygiene. Advice to wash clothes properly. Daily advice to do brush. Advice to maintain personal hygiene. Diet. Advice to eat liquid diet. Exercise. Advice to do postnatal exercise. Ensure mother for early adaptation. Exercise follow-up. Advise mother to follow up treatment. Advise mother to regular checkup. So this is NCP on postnatal care. Hope you like this video. Subscribe my channel, The Nursing Hand. Thank you.